Did you injure your pec while you're lifting at the gym? Today's video is for you. We're going to be going over exercise options for you to get started with. Take a look. Hey everyone, this is Dr. David Song at the Rehab Hero Clinic, and today we're going to be talking about pec strains. The pec is a term used to refer to the pectoralis minor or pectoralis major muscles. Both muscles are very close in approximation in the chest region and can be injured while doing exercises like dips, push-ups, bench press, or any other type of pressing movement. A pec strain could happen for a number of reasons. You could have increased your volume, exercise volume, which is reps, sets, or weight lifted way too rapidly to the point where you actually strained your muscle. Injuries can also be a result of repetitive trauma, so just overtraining your body and not really facilitating your rest and recovery. And other reasons why you might be gaining a pec strain is due to lifting with incorrect or bad form. This could just be something very acute, like you just slipping and moving incorrectly for a slight moment and your pec muscle being caught in unprepared movement, contracted hard and strained that muscle. Oftentimes, a lot of my own patients in private practice don't actually get their pec strained while lifting their maximal weight. A lot of the times they do get injured during the warm-up sets of their exercises or the first few working sets of their exercise. And this just can be due to a lack of appropriate warm-up prior to doing your weightlifting, or it could just be due to accumulation of fatigue built up over the last week or month. This fatigue can be due to lack of sleep, high stress, low hydration, inadequate nutrition, etc., etc. Now, regardless of why the tissue got injured in the first place, it's really important to know and recognize that there are different grades of strains. Strain is just another word for a tear. And depending on the grade of your strain or your tear, it can take a different number of weeks for you to recover, and this is with rehabilitation, not necessarily just rest. The reason why rest in itself doesn't work for this type of condition is that as you rest, you get deconditioning of the muscle because you're not utilizing it. So when you return back to the activity that injured you in the first place, you may notice that you'll get some of that discomfort or pain returning as soon as you start lifting again. And so this cycle of rest and pain and rest and pain just continues and delays your recovery. That's not to say in certain circumstances, if you rest for a certain number of weeks, things will be fine as soon as you jump back into your exercises, as long as you appropriately scale your exercises to take into consideration that you may be deconditioned. The purpose of today's video is going over a set of exercises that will minimize the amount of deconditioning that you experience while also promoting tissue recovery in those pectoralis minor or major muscles. Regarding muscle strains, there are 3 grades of strains. Grade 1 strain is a strain that could take anywhere between 2 to 4 weeks to recover. A grade 2 strain could take anywhere between 4 to 12 weeks to recover. And a grade 3 strain could take anywhere between 3 to 6 or more months for it to recover. Usually grade 3 strains refer to full complete ruptures, in which case you would want to consult your orthopedic surgeon about repairing that tissue. If you're wondering whether or not you have a grade 3 strain, quite honest, it's a pretty traumatic event. You'll see some sort of deformity, lots of bruising, loss of function, and you might not even actually get pain with this one because your nerves themselves have been severed. So this type of issue is really rare. It can occur, of course, especially in fast twitch movements. Again, just consult your healthcare practitioner about anything relating to that. Today's video is really for grade 1 or maybe grade 2 strains and the first steps that you can take to boost your recovery. The first set of exercises that we'll be doing today is for both this acute and subacute phases of healing. This means that you can start doing these exercises anywhere between the first day to the 10th day of your recovery following the initial event that injured you. These exercises are going to be focused on doing what we call isometrics, which is just doing an activation of your muscle in a single angle or joint position. It's really important to note that while we're doing these exercises that it should be pain-free. Now, I want you to distinct that pain and discomfort are 2 different things. If you feel a bit of tension, that's okay. But if it actively hurts while you're doing this exercise, then you want it to modify the exercise so it doesn't hurt as much, and I'll show you how today. So the first thing we're going to be doing is an isometric pec fly exercise. For this exercise, you're going to be needing a stable surface. You can use a wall. I'll be using my band anchor here, or you can use a squat rack. For the purposes of this video, I'm going to be imagining that I strained my right pec, okay? Just so I can keep it consistent with the video and the exercises. If you experienced everything on the left, then just do everything on the left. So first thing I'm going to be doing is starting by placing my hand against that stable surface. And I'm going to be starting in a shortened position, which is just with my arm in front of me at 90 degrees here. From here, I'm going to just slowly, gradually do a contraction. So we do what we call a 3-second ramp, where we slowly over 3 seconds contract by pushing my hand into this anchor as hard as I can. I'm gonna reach my peak contraction and hold that for about 4 seconds. And then the following 3 seconds, I'm gonna ramp back down to slowly relax. And this is so that you can kind of just gradually ramp up, hold a peak, and then ramp back down so that you don't cause your muscles to either spasm or reduce the amount of symptoms or pain you may experience during this exercise. So you're going to pretty much repeat this exercise for up to 5 to 7 repetitions on average. And as you can see, as I'm doing this exercise, it doesn't really look like I'm doing much at all. And this is because it's an isometric contraction. But what you want to do is you want to gradually open up the range of motion to challenge other different angles. So from here, I'm just going to rotate my body a little bit more outwards so that there's a bit of a different angle going through my shoulder. And once again, I'm going to ramp up, push my hand through this solid object, and I'm going to feel my pec activate. And you will repeat this until you could get to your full range of motion. So now my arm is just right beside me and I'm going to do this contraction. And if you can tolerate, you'll be doing it even in this more stretched out position. If you're in the acute phase of healing, you probably won't be able to get this far because it's just going to hurt too much. Again, the acute phase of healing is between days 1 and 4. So for those first 4 days, it's just better to stick to these shorter ranges of motion, again, pain-free. And towards that 10th day of your recovery, you'll find that you'll be able to go into this much more lengthened range of motion. You can repeat the same process, but at a different hand height. So I'm going to be raising my arm up to above shoulder height, and I'll be doing the same exact exercise. Again, doing a few repetitions at all these different angles until I eventually hit my end range. What we're doing is we're trying to just restore some function through pec fly movement. So we're going through like a regular pec fly and then also an incline pec fly movement, because those movements just happen to align with your pectoralis muscles. You can also do this with your hand below shoulder height, so kind of more towards chest height, and repeat the same process so you can get those lower pec fibers. Really, you'll be targeting the angles that you feel the least comfortable doing, but you're just going to be doing it in a pain-free motion. Another factor that might play a role into how much pain you might be experiencing while you're doing these isometric exercises is how hard you're pushing. So you don't necessarily have to go to max effort if max effort elicits pain. So instead, you'll just scale up to the point where it's pain-free. You might feel some discomfort, but it should be pain-free, and then you ramp back down from there. So if that means you can only put about 50% effort while you're doing this contraction, then that's what you're sticking with today. Tomorrow you could try doing maybe 55, 60% activation. Eventually, towards that 10th day, you might be able to achieve that 100% activation. It's really important that while you're in the acute and subacute phase of healing, that you're not just trying to stretch your pec out, hoping that this will make it better and pushing through pain. This can actually delay the recovery process for you, and it could cause unnecessary sensitization of your pectoralis muscle. So it's really important that we're getting the muscles to move, we're engaging the muscles, but we're not pushing them through any type of pain. All right, so that sums up the very basic exercise program that you could do for the first 4 to 10 days of your recovery. Next, we're going to go over what to do over days 10 to 30. All right, so this next phase of healing, or the mid phase of healing of your recovery, we're going to be doing a lot of the same similar movements you would do in your workouts at the gym, except for we're going to be changing up the way we're doing it. So we're going to be focusing on what we call the eccentric phase of the motion, which is a downward phase of the motion. And we'll be decreasing the overall weight lifted, the number of reps done, and the number of sets done, so that we're just really focusing on control, pain-free reps, high quality, and really engaging the muscles to activate. So one of the best examples of doing this is that we're going to be doing what we call an eccentric push-up, and you could be doing this from the knees, especially if it's like day 11, or you could do a full push-up if you're strong enough and if it's closer to day 30 of this program. So we'll be doing, for the sake of this video, a knee push-up. First thing, we're going to make sure we have a padded surface, and this is just to protect your knees. So I'll place that on the ground. And then I'm going to assume a knee push-up position, just like that. From here, I'm just going to focus on a 5-second downward movement. So I'm going to take 5 seconds or 5 steamboats to come all the way down. And once you're down there, you can push back up. Or if you need to cheat your way up, you can do that too. Meaning that if you need to kind of just use your knees to prop yourself up and reset, that's completely fine. Your tissue is still strained at this point and still recovering. So it's okay to cheat the movement so that you can focus on this eccentric movement only. And so from there, you're going to just do 5 seconds once again. And be sure that this is a pain-free movement. So if you feel pain kind of towards this more lengthened position towards the bottom, you're just going to stop maybe just short of that. So that might mean that you just do half repetitions. Again, we want to make sure that we're doing comfortable repetitions in terms of pain control. And it's not that the pain necessarily will do any harm. It's just we want to make sure that the pain is not interfering with the quality of our repetitions and we're not resensitizing the structures around it, okay? So it's not necessarily that you're going to restrain it, but we just want to make sure we're doing comfortable workouts here. So next we'll be taking the same exact principles and we'll be applying it to a cable pulley machine. And the next exercise that we'll be doing is a cable pec fly. But again, we're going to be doing it with a focus on the eccentric movement, which is the negative phase of the movement. So first we're going to be setting up this cable pulley machine around chest height for pec major. If it's pec minor, it'll be closer to shoulder height. And you could do this with both arms or just one arm. I'll be doing it with both arms because I just find that doing it with both arms helps to maintain your balance a little bit better. If you don't have a cable pulley machine, you could just do an exercise band. Just make sure you have it anchored to something solid behind you. But first you're just going to pull your hands together, lunge forwards a little bit, stabilize the movement, and hands forward. So from this position, you're just going to take about 5 seconds to slowly lower the weight stack as far as you can tolerate. So once again, if I start feeling pain about here, I'm just going to stop short of that, and then I'm going to just complete that repetition once again. And then you're going to take 5 seconds to complete that range that you can do. So if you only have half that range available to you, you're going to take 5 seconds to get to that half range point, and then you're going to pull back in. If you have the full range, you're going to be doing the full range. And as you notice, as you're doing these exercises, you should notice some improvements on a weekly basis. Now, since these are strengthening based exercises that we're doing for the mid phase of healing, you're not doing these exercises every day, just like how you wouldn't want to train your chest muscles every day at the gym. For this phase of healing, you're not going to train these muscles every day either. Instead, you could do this about 2 to 3 times a week. I find 2 times a week to be plenty, 3 times is even better. And you're just going to do this at one time for that day. You do anywhere between 2 to 3 sets while you're doing these exercises. And because we're focusing on the negatives here, we're also only going to be focusing on doing anywhere between 6 to 8 repetitions. Now, while we're doing this, if you find that the exercise is a little easy, of course, you can increase the weight stack so long as it feels comfortable on your pec to do. So next, we're going to go to our final exercise of the series. All right, so the last exercise that we'll be doing is an eccentric dumbbell press. We'll be doing this exercise again just for the side that is strained. You can do both sides because it's a little bit easier to balance, so I'm going to be doing both sides at the same time. Once again, we're going to be focusing on doing a 5-second negative for this exercise and then coming back up. You could go up at any tempo you choose. Once again, we're going to be sticking to a pain-free range of motion. I'll show you what that looks like. First, we're going to be starting with our hands in this shortened length position, which is your hands straight above your chest. And you're going to take a 5-second tempo to lower your arms as far as you can. So if you do have full range of motion, say it's closer to day 30 of your rehab program, you'll find that you'll be able to get all the way to the bottom. But say if it's day 11, you might find that you can only go about halfway or maybe 3/4 before you feel a little bit of tension or pain. So instead you'll stop about 5 degrees short of that or an inch short of that, and then you're going to just come back up. And you'll take 5 seconds to complete that range. So if I only have about half range available, I'm gonna take 5 seconds to complete that, and then I'm going to come back up at any tempo that I choose. If you want to come back up slowly, you can, but you don't have to. Once again, because we're focusing on the eccentrics, technically, just by slowing down the tempo, it increases exercise intensity, which is why we're only aiming for about 6 to 8 repetitions per working set. The amount of weight that you've lifted will really just depend on how strong you were before you got injured. The exercise difficulty is a separate measure than the amount of pain you feel during the exercise. They're not one and the same. So we want to aim for about a 6 out of 10 difficulty, but less than a 1 or 2 out of 10 pain during the exercise. Finding this exact number for you can be a little bit of a trial and error process, where you might find that lifting 5 pounds heavier will push you into the 3 out of 10 pain threshold, but it will push you into the 6 out of 10 difficulty range. So you'll have to play with the numbers to find out what works best for you. Once again, it might just mean that you have to shorten the range of motion at that heavier weight, just so you can hit up that appropriate 6 out of 10 exercise difficulty. And this rule kind of applies both to the eccentric fly and the eccentric push-up exercise that we did earlier in today's video. Once again, all these exercises will be done about 2 to 3 times per week. You'll be doing 2 to 3 sets, 6 to 8 repetitions during the mid phase of your healing. All right, so at this point, if you have a grade 1 strain, you should be feeling a lot better. Now that we've approached day 30, we kind of reached how long it usually takes for a grade 1 strain to fully recover. In which case, you could go back to returning to your regular activities. Just keep in mind that you might be a little deconditioned compared to your pre-injury state. If you're dealing with a grade 2 strain, then you'll be doing these exercises for another 4 weeks. So you'll be doing this up until day 60, in which case you'll transition to what we call return to sport exercises. So at days 60 to 90, you'll be slowly returning back to the same activities that you were doing prior to your injury, except for you're going to scale back on the exercise intensity and still really just focusing on optimizing your form and controlling the weight that you're lifting. This might mean that the amount of weight that you're lifting is going to be about 20 to 40% less than what you were doing previously, with week-to-week gains returning back to your previous lifting numbers. If you're still experiencing some pain in the chest or in the shoulder region, even though you're doing some of this rehabilitation, it's really important that you consult a healthcare practitioner like a physiotherapist or sports chiropractor. If you're looking for one in the GTA area, we have here 2 clinics, one in Markham and one in North York. You could book in with us using the link found in the caption below or just going to rehabhero.ca. If you like this video, please let me know in the comments below and give this video a like. Subscribe to my channel if you haven't already, and I'll see you all next time. Peace.